Welcome to our monthly grand rounds. We generally use the grand rounds to, invite folk who have very different perspectives to what we have, especially in the field of innovation, behavioral health, and artificial intelligence, which the Institute has been focused on over the last year and a half. I think hospital design is a neglected but extremely important part of charting the future of health and healthcare. And as I think the challenges in healthcare continue to mount, but as technology continues to evolve and shape the future of healthcare, we really have to start thinking about what the future hospital is going to look like. These are not places of sick care. Hospitals are not just buildings, they're places where professionals spend most of their lives. They're places where people come to seek care, both mental and physical. And they're also places where world-class cutting-edge research is done. And the key question becomes, what should the future hospital look like, given the context of the challenges and given the major trade in the future of healthcare. So we're really privileged today to have, two leaders in the space of healthcare design, Tushar Gupta and Vaughan. Both of them are from kind of one of the world leaders in medical architecture page. They have pretty impressive CVs. Tushar is an esteemed fellow of the College of Fellows for his exceptional work. He's a market sector leader at Page and is known, and his kind of work focuses on innovation and design for health. Mark is the healthcare planning director and a principal at Page, and he's also certified by the American College of Healthcare Architects. And both of them have pretty impressive CVs, and I think you'll find their presentation pretty useful. But before we dive into that, one of the purposes of this event is for it to be interactive and collaborative. So we will save some time towards the end for questions, and I really want to invite you to, get into a robust discussion with our two speakers. So, without any further ado, Tushar. Thank
you, Dr. Pillai, and thank you to all of you here that are with us in the room and those that are joining us virtually. It is a real privilege and honor for us to be here because, as you just heard, we're architects. We don't get invitations to grand rounds. And you might be wondering, what in the world are these architects doing speaking at a grand round? Well, the reason we as architects are here today to have this discussion, dialogue, conversation is because we're passionate about the space of design or what design can do within the healthcare space. That's something we strongly believe because we believe design can inform the journey of a patient, a family member, a care provider, a researcher, even anybody that sort of just comes there for a visitation. So anybody and everybody that sort of engages with the built environment, we believe that there is a role there that we play as architects, especially those that are focused in this particular space. And that's the reason why we are here. Today, as Ruben said, we're going to be focusing on thinking about, what are the attributes and tenets that inform the future of healthcare design. But we're going to take a very different story. We're not going to show you a bunch of just these projects and, where it's been, but rather evoke conversation around some topics substantiated with some sort of case studies and examples, but it's going to be a slightly different take that we're going to have. But before we go, Mark, why don't you take it away?
Yeah, so before we just kind of jump right into this, so if you have your smartphones, for those online, you can take a picture of the QR code. We're really curious from your perspective, where you see, what are the top influencers that will shape healthcare from your perspective? And we're asking this question because we've sort of pulled some of our own information, but we're curious where you're coming from. So if you can do that, and then you want to pull up the,
Yeah, I just want to make sure that everybody has an opportunity to scan that QR code.
we're seeing a note here, to see the
Okay.
room, but not the slides.
We're gonna,
So we need to share.
okay, right there.
Jeff, are you seeing the screen now?
Says you're sharing.
Not yet.
This one, right? Yes.
Nice words coming in there. Okay.
Let's check if they're still. I'm gonna go back to that. Can they see it? Oh, it looks like there, it's not projecting. Do we have to reshare this screen then? They're not seeing that. We have to reshare here. It says you're sharing in the.
Yes, we have patients, AI, technology. So we're going to hit on some of these. This is awesome. Thank you so much, everyone, for your contribution. We're gonna go back now to
Yes, I'm gonna stop. I'm gonna try to see if, I'm gonna make sure that when we go back that this comes up and everybody is able to see it because we were having some sharing issues. Okay,
So we took that from you, but from our perspective, we asked this question repeatedly in a number of audiences. We hear all kinds of things, much like you just gave, but what we're gonna focus on today are these five. And there's all kinds of topics that can influence the future of healthcare. We're going to look at these topics, and we're gonna really ask, we've been asking ourselves, what's the imperative for design as we think about the future of healthcare? So Tushar, you want to organize this?
so I would describe to you, when you take on the design process is a journey. It's like when you start, you set a vision, and with the vision is a roadmap. So that's where it all begins. But once you set the vision, okay, we're gonna take a trip to the vineyards. Well, what's the second step in that design process? The second step is what we call placemaking. And placemaking is about creating a sense of place. It's about these cluster of buildings, this integration with landscape and nature. And what that creates is a memory. We were talking as we were walking in the hallway, what is the memory that you have when you come to UAB? You know, what is your memory that you want to kind of keep? That's what sense of place is about. And that's like step 2 in the journey of the design process. Step 3 is now you step into this beautiful wine room. There's soft lighting, comfortable chairs, you're enjoying a wonderful glass of wine, you know, enjoying some laughs. It creates a memory, and then the space becomes part of that vessel that surrounds you to give you that sensory experience. And experience is the third attribute of design that you experience in part of the process. So as we take the journey today with those 5 tenets that we're going to go through, we are going to see them through these 3 lenses. Number 1 will be our roadmap. Number 2 would be placemaking, and number 3 would be experience. And that's, so you keep that in perspective as we walk through the 5, and we'll kind of look to continue to do that. So let's jump into the first one, engaging our community. We believe there is a role that we all play as part of the community. In our humble experience, what we have seen often, healthcare places become almost like islands in the community. When you're healthy, I don't want to go to a hospital. But what we forget is today, life is about health and wellness. This is part of our everyday fabric. And how can we take these buildings and treat them into buildings of health, not about care? Dr. Pillay just talked about, you know, kind of changing the paradigm from sick care to wealth care. So that's kind of the first thought that we have. So what's the roadmap? let's click it. The roadmap for us is how can we integrate these facilities within the fabric of society? Now, when we look at society, let's kind of go to the first slide, which is about there is an urban kind of connection. We're in a city, we're part of a big city. You know, how does this become part of that urban connection? And we start to integrate where they feel like I'm taking a walk in downtown, having a coffee or going to a restaurant. It's no different than how we should be experiencing healthcare when we come to it. So an example of that was in Connecticut, we had an opportunity to work with Stanford Hospital. They were located in a very urban neighborhood, but basically like had a fortress around it. They had a residential area, there was some commercial, it just surrounded the hospital, but this hospital was an island. And through a very engaged, interactive, participatory master planning process, we were able to create what we call hospital building development. We took assets, Leone Park on one side, Mill River Park on the other side, and connected them with series of walking trails that became green belts that allowed the community to connect to the hospital and for the hospital to connect back to the community. It went one step forward where that master planning didn't just think about healthcare, because we were interested in this conversation about what happens outside the walls of the hospital. It was about how can we renew the urban stock that lives adjacent to the hospital, because people live there, they work and they come to work there, they shop there. So it's kind of like this mixed live, learn, work, etc. There's even an urban farm that exists that was created to create a community anchor, and that farm obviously teaches you about good health. The vegetables that are grown are sourced by the hospital. You can see the hospital is in the backdrop of this farm. And then on the weekends, they have yoga, Pilates, and other places so that it becomes, so then again, the hospital is starting to become part of that community. And as we kind of connect that. So at the end, as we envision this kind of environment, what is that sense of place that I want to leave you with? Is an impression of it's a welcoming place that connects me to the tissue of the fabric. Now, sometimes, you know, our institutions are in campuses. UAB is a perfect. UAB is part of a campus in a university, and there is a role of how do you connect to that. So when we drove yesterday from the hospital site to the other part of the academic center, we saw a slight shift in the experience. You know, there's a different vibe here than it's there. And as we build buildings that are part of a campus, there's an important sort of a responsibility of that connection. In Denmark, we are working on a project which is under construction where for Bispebjerg Hospital, where Bispebjerg is part of, again, an academic campus. And you can see in this photograph right here on the red roof tiles, there's a very distinct character of buildings that exist. So the new hospital, as we are creating it, is respectful of that. It's not trying to mimic the architecture. It's trying to capture the essence of what that wants to be. So that as you start to look at the new buildings, they create those series of courtyards. They create a series of kind of an architectural character that still resonates with what the campus is, so that is campus impression is maintained. So Mark, as we kind of take it to the next step and talk about kind of placemaking, let's just sort of get into that.
Yeah, so really, as we think about kind of where we're going with really creating an incredible experience, it's all about bringing people into a place that they actually want to be, even in healthcare. So Tushar talked earlier about sometimes if you're on an island. So what can we do from the basis of engaging the community, creating open spaces that are inviting and people want to be at, creating opportunities where there's a market day to encourage great, whole food choices, educational events, as well as fitness, outdoors, and it becomes a piece of what's happening in the community and desired by the community. This project here is in Greensboro, North Carolina, has been over the top, very successful. It's an outpatient clinic, but more importantly, it's a community-based wellness center. And so what's happening on the inside is all kinds of things, from fitness to outpatient pharmacy to clinics. But what is really the draw to the community is all the opportunity to really focus on physical and spiritual health. So all these sort of activities, and then inviting the community in to events, concerts, movie nights, all kinds of things that engage the community. And what happens? We're in a society, and we'll touch on this a bit later, where everybody's connected via social connections and their apps. So this is all over the web for this place, and it's just growing and growing and growing. More people are becoming members, and the membership is very low amount, and they said this is just really phenomenally successful for Cone Health. So as we think about that and really challenge ourselves on a project, how can we put a focus on health and wellness and educating people towards really solid life decisions about their health? And in this project, we really thought about the idea of creating a health and wellness museum where it's elevated, that whole notion. So in this project, we created this really dynamic space. It's tied in and becomes, part of the overall experience and puts it top of mind so that you get away from childhood obesity, things like that, where, not the best decisions are happening. But then we have to consider, what about the society that's really struggling we're on a food desert. They're struggling to really every month have good choices for food. So we have a client, Harris Health in Houston, that has generated this whole idea that food is medicine. They started this back in 2017, an amazing program. So Tushar, you want to hit that?
My name is Hope Galvan. I am the Administrative Director for Clinical Integration under Population Health Transformation Platform. So the food pharmacy was developed back in 2017 as a concept under Food is Medicine. We started food insecurity screening at our healthcare centers, and a lot of the patients were expressing food insecurity, which means they couldn't get their hands on food or they were running out before the month was over. So in visualizing this, we started looking to see what resources are out there. And we ended up connecting with the Houston Food Bank. What we did was develop the program around a patient with diabetes, because of course that's one of our top diagnoses. So it's really a one-stop shop for our patients who are food insecure. They come in, they see the doctor, they express the food insecurity. We provide them with 30 pounds of food every 2 weeks if they agree to the program and they have diabetes. Every time that they come in, they'll get education. Part of that education is talking to a nurse patient educator or talking to a registered dietitian. I see the program growing at a national level because we've been given an opportunity by the Houston Food Bank to be an example, as well as 5 other organizations across the country, of food is medicine. And how is healthcare implementing it in their clinics, in their hospitals? So I'm hoping that we are able to show outcomes through blood pressure, through cholesterol, through A1C change, that shows the rest of the country that we can do this in healthcare and truly provide that holistic model that we've always aspired to in healthcare.
This has been really successful since 2017. So if you go on top now and YouTube that, you'll see multiple people adopting this idea. So it's a trend and a ripple effect that's happening in many other places. So then we get into this idea of creating opportunities to educate and demonstrate, food and nutrition. How can you cook and prepare, helping kids even in the children's hospital to see, that side of things. Well, what about connections? Food is such an important way to engage with people. So as we think about the community and creating places, destination places where conversations can happen around food. So how do we engage the hospital and healthcare facilities that are adjacent to that? You have some of this right around here in walking distance. And then another element is creating spatial connections. So as you think about very distinct aspects of disease specialties where you have both inpatient and outpatient care, how can you create space that's inviting so that those people coming there, there's a small community within that environment that they're getting used to, the clinicians, the providers, and other patients that they see on a routine basis. So that becomes a small community that can be done horizontally or vertically in the building, but it's one space that really becomes that portal for that service. And we see that in a few places. All right, so Tushar, we're going to go on to technology.
So talking about technology, as we just said, it is so amazing how this has informed our everyday life. And, it has become such an important part of that conversation, but that's not what it's about. If what it's really about is when you come in, sometimes you're surrounded by technology, in fact, overwhelmed by technology, there's just like everything, but is that what we are really after? Yes, we need technology to help us. I know that was one of the big words that came up, and we agree with that. Technology is going to be the way we're going to shape the future. But when we see it from a design perspective and we see what's next, we really want to humanize that so that technology is there, it's present, or it's omnipresent. So as you start to think about that, our roadmap imperative is, how can technology be omnipresent in the built environment because we are going to need it. We all the time, every day, every moment. But we don't want the technology to become the front face. We want the place that connects people to be that first connection. Well, a couple years before UAV was created in the 60s, the Jetsons were really thinking hard about what is going to happen about the future of healthcare. They were thinking about smart TVs. They were thinking about smart watches. They were thinking about telemedicine. They were thinking about a pill that will take. This is like, imagine in the 1960s and today, what we know is that it's here. Healthcare of the hospital of the future 1.0 is already here. We, like what you see here is a complex for Houston Methodist and the Texas Medical Center, where on the building on the left is Walter and the building on the right is Centennial Tower. The one on the left was opened in 2018 and the one on the right will open in 27. But all these technologies that we're talking about, whether it's robotic surgery, artificial intelligence, kind of being integrated into that, ambient intelligence is being used in the patient room to monitor you from falls, for virtual nursing, but also in the OR to make sure that the cases, they're basically monitoring all the equipment. When there's a case that comes in, they know exactly what it is, and they're using to completely monitor so they can keep a tab of things like that. So a lot of the kind of things that we're talking about today is actually here, and that's important. Another thing that we're seeing, we're building these kind of cockpits for a lot of our clients here at Nemours. In Florida, they have a facility in Orlando, and then they have one in Delaware. Well, they're monitoring every patient in their system right here. And what that means for us when we kind of continue to take it forward, well, eventually this patient will migrate to the home at some point. Again, how do we kind of continue to keep that connection when healthcare moves in? I know it is still in its infancy. There's a lot of debate and dialogue about when that will happen. Well, we know it's going to happen. It's just a matter of time. And when that happens, we need to be prepared to kind of be able to connect that. But what we're really after is 2.0, because a couple of 4 or 5 years down the line, when we think about it, we've talked about AI was one of the things that came up. AI and machine learning would have been mastered. VR and AR is going to be normalized because that's just how we're going to be experiencing a lot of the space. And sensor and detection is going to be everywhere. But our job would be, as designers, we believe, so it's omnipresent. But at the end of the day, technology, as I said at the beginning, we want to make sure we're humanizing it. Here in this area, we're using technology, but to humanize that experience for a child that's here waiting for their cure, where they can engage with this interactive digital wall, play with color and light. And here is a role of kind of humanizing that technology.
All right, so as we take this and move it to creating great places with exceptional experiences, 4 things come to mind. We've had some really great discussions with Dr. Pillay, and really what we want to focus on right now is what we call the 4 Ps. So we're going to walk through each one of those, thinking about it from the perspective of design. So the first is predictive. I mean, technology, obviously, there's a lot of hope about leveraging technology in a really amazing way. But as we think about it from design, what are the opportunities when you're talking about robust sensor and geolocation systems that are tracking phones? Can you imagine a day where your device knows when you left home before you get to the hospital, so you can predict where parking needs to happen, and you're directing the patient to where that parking availability is? That's one example. So future-proofing the garages, perhaps in the future, the garage no longer needs to be next to the building, because maybe the future is going to be much more autonomous vehicles. What needs to be robust is the valet engines, and the car then drives away to a garage. So thinking about both now and the future, the garages may need to be differently. Another great example is this idea, I think I overheard this idea of a digital twin. But we are quickly heading towards, and I was just talking to a vendor very recently about not only taking a 3-dimensional model of our healthcare facilities, but populating it, tying it to the electronic medical record, other sensing technology, so you know exactly what's going on in the environment. Why is that important? For us as designers, we want to constantly be knowing what's happening and create process improvement, better experiences, raising the bar in those to create even more exceptional experiences, but more importantly, back to predicting what's needed in the future. That will tell you everything about supplies, what's coming, so you can tie your staffing model to that. You know, if it's looking at 15 scenarios, which these programs can do that, it can tell you 5 days from now what's anticipated with relative good accuracy. This has been being done on the manufacturing side, and I think it's coming to healthcare. The next P is preventative. So this is an example. It's a bit old, really. But so, you know, and Dr. Pillay can tell you, I'm sure, all about the miniaturization of technology. But what's interesting about this example, and this happens to be a plan for our comprehensive breast care center project. And what we are working greatly on was this idea of creating a very seamless experience that gives a very dignified, fast in out experience without, you know, I'm sitting a sub waiting in a road. So the mom or the woman will come into this breast care center. But what's really important is what's changed from last year. We're talking about a screening event. Is there anything in her history that would indicate a greater incidence towards some cancer? How can we prevent a latter stage diagnosis? So getting it back to 0.5. And in our conversations on this project, creating these spaces that are very dignified, where in those spaces, a lot of things are happening, but they're engaging with technology. So they're engaging with nature, they're engaging with, you know, a really nice design space, but what we call SNAP, bidirectional technology, that's running through 2 or 3 platforms and predicting what's happening with that patient that may be indicative of a greater need. So in this case, what we were talking about, even though there's, you know, I agree with Lee when there's a lot of miniaturization, but for this project, we're looking at a breast MRI. So rather than a typical tomographic scan that might be part of an annual screening, we're seeing something that should be done at a deeper level, like a breast MRI. And so as you think about that from an insurance provider, there's a lot of value to offer to say, if we could catch this earlier, we're going to save a lot of money. We're going to save a lot of headaches for the patients rather than catching it at a stage 3 diagnosis or latter. All right, so moving on to personalized. So obviously the devices can tell you all about where you're at. If you're tied into a real-time location system, our designs can create scenarios where it can be self-grooming concept potentially, or at a minimum, a very dignified experience where I can walk up and go, Mr. Gupta, we're ready to see you, instead of it being blurred out or it's not personal. So there's a lot of opportunity there. But as we think about it from a design perspective, if there's sensors in the tide, they're also smart. They know who you are and they know your preferences. So when you come into this space, it's changed to adapt to your interests specifically. So imagine that, you know, creating a room that could do that. The last one is participatory. So as we think about spaces, how can we engage, create spaces using technology that's seamless and omnipresent, but really ultimately encouraging patients and providers to really idealize that experience so they can get the best out of that. Providing information, many of our Plain Tree projects, that's all about empowerment on medical information. So providing opportunities where they can engage with that information. And then ultimately in the room, creating environments. You've been probably some boutique hotels that are already doing a lot of this. I can control the music, I can control the shade screens. A lot of things are happening here. So imagine some really smart walls. I want to see and feel what I want to feel, smell, just all these opportunities. Technology really can offer something very, very unique. All right, Tushar, as we start to head into another mode, which our third item is promoting intellectual collisions. So it's all about convergence.
Mhm.
So as we think about that, you want to take us from here?
Yeah. So if you go to the next slide, what we are really interested in is that we believe that the future of medicine is about convergence. You know, it's already occurring, but this is going to be the holy grail of the future of medicine. And as designers, what can we do to sort of make or foster that idea? So at this project at UT Southwest in Dallas, Texas, when we were given this opportunity to think about how could we create this sort of intersection where there was a research site and there was a clinical care site, was to create these series of buildings that sort of house that functioning. But it's the in-between space that allows you to come together, not only in these bridges but also in these nodes where people sort of come and become collaborators. So as you look at that 3-dimensionally, it becomes a space that not only provides you opportunities of space, but encourages that kinds of what Mark, you were referring as serendipity connections that happen in the course of the journey.
In this project, there's both clinical research, the Brain Institute, and cancer. So it is all about trying to figure out how can we get them out of their silos and even through serendipity pathways, break spaces, so that they're cross-pollinating and moving towards innovative ideas that advance patient care through discovery. So, even spaces like this where people are intersecting, having discussions that otherwise, if that never happens, they're working in isolation. You see that in a lot of academic campuses. They may be spread out instead of, how can we create those intentional moments? So, as you go ahead.
Just click
So as we
forward.
just think about now going to placemaking and the experience, it's all about creating very intentional spaces that can foster collaborations, again, for that very purpose.
And that collaboration and intersection doesn't really have to happen inside the building. It could be under a beautiful tree in an outdoor space. This happens to be the Health Learning Building at UT Dell in Austin, where it was designed to sort of support and foster that interaction both on the outside, but as well on the inside. Now, communicating stairs are a great way to get people, up and down. There's a lot of obviously associated thoughts with health and wellness, but just by oversizing the landings, it has created these moments of pause where people just actually stop as they move between the building and have those serendipity kind of intersections and conversations. So the building becomes a vehicle that allows you to sort of foster that level of collaboration. Now that collaboration can also happen offstage. How do you create a really wonderful sort of an environment where people can come together, whether it's in a lounge space like that sort of promotes that, or at our very own Starbucks, and do you just create these little pods where people can kind of get together and kind of have that? And I think that's another way to really sort of think about that. That same conversation can happen along the edges of the building. Like at Trinity, we created these bifold doors that open the building up to allow on a beautiful day to have those kinds of interactions between inside and outside, or on a green roof. We just walked through the Children's Hospital, took a tour there, saw some of the green roofs that they have made accessible. And I think this is an offstage space at Stanford, which is only dedicated to the caregivers, not to the public, so that they can be offstage. They can have those conversations, etc., as they go through that. But eventually, how does that come into your academic space? Like, does your space promote you to kind of have those collisions, have those conversations, and kind of continue to kind of move forward? This last example that we wanted to share is at Virginia Commonwealth University, where again, there's cross-pollination happening between clinicians, biomedical engineers, and scientists. A similar idea is being developed in Texas, where Texas A&M has created the first of its kind program called NMED, Engineering Medicine Degree, which takes engineers, or it creates what they call the first physician years in the world. So they have a dual degree between medicine and engineering, where again, you're kind of creating those kinds of spaces and areas to kind of allow them to kind of get into that. So Mark, let's pick it up with refining delivery.
Okay, so on this topic, we really thought about, delivery. So much depends on how it's being done to the point. And so as we think about that, there is so much importance given to how do we create engaging, happy, and fulfilled staff? Because if we can accomplish that and we can be a part of that through design, then we know it can have a very positive impact on the patients and positive outcomes. So our mantra, our true north here for vision, is really caring for the caregiver. And we want to figure out how we can do that with design. So of course, creating in different healthcare spaces, depending on what it is, this happens to be a nursing, we call it a 12-bed neighborhood. And so there's so much about the work at hand, making that very ergonomic, but also from a safety perspective and being able to care for patients even when you're not close by. So being able to have terrific line of sight so that from the nurse work area, you can see directly into the room and to the head wall. and you can monitor those patients who are a little bit at risk. If you then take that concept and combine it with sensor ambient technology, you can track those patients who are at risk on falls, and the list goes on. But really paying attention, getting things as close to the work that needs to be done to minimize steps, so that the work that the clinicians are doing, they're able to operate at the top of their license and really doing the very best job they can.
This is about self-sufficiency. Those neighborhoods is all about self-sufficiency because you want the care provider to spend time in caregiving, not in hunting and gathering. And I think that's what that allows you to do.
And then sort of back to that cross-pollination, we know that creating multidisciplinary spaces that encourage clinicians and providers to really work together. We know there's a direct link in 81% of the cases based on research that tell you that positive outcomes can happen. We create those spaces that are near the clinical care area. So this happens to be an enlarged plan of a cancer clinic that we worked on in Dallas. The orange space in the back is where some of that work happens. Now, man, there's not a greater place that I can think of where we really need to think very holistically about the staff and the patients. This is a picture of Fulton State Hospital in Old. So, a lot of things probably come to mind as you look at this, and it's a prison, we're not really sure. It is at this place they do both forensic and civil behavioral health. But let me take you to some of the things that we're doing with this client. It's now built, but this was the plan concept. So from the caring for the caregiver, those 6 blue stations is where the caregiver is working. So how can we create the very best in that area to take care of the residential treatment that's happening? So let's take you through a bit and show you what's happening.
So this is the after from the before. I think one of the key things about this, with the work that's happening in this particular space, is there is a lot of stigma associated with behavioral health. There is a lot of, like Mark said, maybe sometimes association with an asylum, but how can you take these are also places of healing first. It's a disease. It's not, something that is, and it's a societal need. So as designers, we think it's a great responsibility for us to again humanize these spaces, dignify these spaces, and give them an identity. So when somebody goes to this, they feel proud. They don't, there's nothing being ashamed of to, go seek care in a place such as this.
Did you all keep any of the old buildings?
It's being repurposed for
That's adjacent.
just for administrative.
I'm just checking.
Yeah.
I can't see anything that looks like the original.
Yeah, this is
Yeah.
a total greenfield. So back to the,
About our physical plant, that's gonna be my question at the preview.
and you've seen a lot of movies and things that portray, just the
Yeah.
nature of these of behavioral health, which is a negative, but this is very positive. But we spend a lot of time to make sure that the staff is cared for from a safety perspective. We need to make it safe. The clinical staff that are working here and caring for the residents being treated. But we don't want to create barriers. There's still communication. We just want to make it safe for them. So it's even things that are very important in this particular environment.
So as we think about placemaking and experience, again, we bring it back to, what is the role design can play in that process? Creating these offstage, we always, patients are always at the center of the universe and they always will be and they should be. But at the same time, as Mark, you talked about that there's equally important to take care of the caregiver. And in this case, providing caregivers the access to natural light, to outdoor space, to rejuvenate, even in the setting of, and this is an OR sterile port, where basically there was space created right outside the sterile port for physicians and clinicians that may have been in a long procedure or a surgery could step out, take a phone call, take a breath. Sometimes these could be very stressful moments, emotionally, physically, and so providing that is important. Now we know not everything in healthcare leads to a positive outcome. Sometimes you end up with situations that really kind of, can take you down. Providing a space where you can have a quiet moment to shed a tear is equally important as to provide, as you said, happiness and fulfillment, or just a quiet space where you could just rest, relax, and just rejuvenate are really important. As care providers, we have families, we want to make sure that, how do I make sure I balance both? So providing like childcare within the institution is another thing that we're seeing with many of our clients that sort of becomes a big staff satisfier. Now, in addition to, it's about the mind, the body and the spirit. In this case, how are we providing those mindful fitness opportunities for the staff members so that it's not just about the outdoor spaces, but also about the indoor spaces where you can continue to do that. But I think I'll just take a pause and pivot us now completely to say, this is just to provoke thought, and we wanted to throw in just a little disruptor, which sort of I'm looking forward to your question here. To really ask the question, as we imagine the future of healthcare, why does it have to look like a hospital? Often when we think about happy or positive encounters, we say, what's the memorable? You think about let's say a resort. You go to a really nice resort, and of course there is functional needs in the hospital that have to be met. That's not a question. But can you start to reimagine what they could be as we start to think about it? Why do spaces look like, why cannot waiting or transition looks different? Why couldn't we kind of reimagine those spaces? But eventually what we want to think about as we sort of move this progression of healthcare is that there is a big shift in thinking about holistic health, which is taking the best of Western medicine, but balancing it with the attributes of Eastern medicine. So as an example, in Mumbai, the Hinduja Hospital had envisioned creating what they call the World Knowledge Center, which would be a place of education, research, and holistic health. So the piece that you see in the middle of this thing, of this rendering, is kind of where the convergence happened between Eastern and Western medicine. And then the wings that flank out are basically the patient care spaces. This project was also ahead of its time in a way that sustainability was a very important thing that they wanted to, again, thinking about the carbon footprint was something on which really kind of brings us to our last tenet that we wanted to talk about, which was around sustainability.
So you've seen all kinds of new stuff, but this is a huge topic worldwide. And, really, quite frankly, healthcare has been one of the last building types to really embrace this. We get it, it's 24/7, much bigger issues that we deal with, but look at these stats up there. The healthcare sector is responsible for almost approximately 5% of worldwide emissions, so it's a big user. And then if you just look at the materiality, what we're standing in right now, the subordinate floor and in the building type, but just the idea of cement that's involved in concrete. If you took that one factor worldwide, it would be as if the third major contributor to emissions. So it's a big deal. So as we think about that, what is our true north vision as we think about sustainability? And it's really back to this, in medicine, Hippocratic faith, which is we want to do no harm. How can we create buildings and places that do that and do that through design? So obviously a big focus on decarbonization, using a lot of these types of things, electrification, energy storage, renewable energy, looking at ways in which we can take a really hard look at the building facade, making it smart and responsive to its environment, its orientation to the sun, hot and cold aspects that influence the building, all sorts of things like that, as well as heat island effect, and go back to that whole notion of landscape. And Tushar will talk about that in a minute. Tushar, you want to talk about this?
Yeah, I think, access to light is a really important thing for us. But one of the things that we have to always remember in a healthcare setting, human comfort is equally important and important precedent. So we have patients that are glare sensitive. So how do we create buildings that balance access to light with energy efficiency as well as human comfort? And so we're using a lot of parametric modeling to do that. This is a story that I've already shared with you of Stanford Hospital. And in addition to kind of some of the attributes that they made as a commitment when they took this project on, they also committed to renewable energy as part of that. So they have on their campus a fuel cell that they have gotten installed as part of their commitment to that. We looked at PV, we looked at some of the other geothermal. Those at that moment when this project was done did not work out from a financial payback that they were looking for. But they got some federal grants and they were able to kind of pull that off. This is another project for Hackensack Meridian in New Jersey. And the story on this one that I want to share is not about the building, but actually about this project. When we were first invited to work on it, there was no site. It was basically an electric yard with a whole bunch of utility stuff. So we had to take that, consolidate, create a new central utility plan that afforded them the opportunity to think about how can we create this central nervous system that keeps this engine running and do it in a much more efficient. In fact, it's been recognized as one of the first peer certified gold projects.
So this project here is kind of taking another look at materiality. So we challenged ourselves. This is a 5-story outpatient building, multi-use, pediatrics, adult care, and even places for staff to work inside this building. And we really wanted to take a different approach about the materials. And we incorporate mass timber as a solution, both for the aesthetic properties, but also thinking differently about the use of materials, not such a giant focus on steel and concrete, which again is back to that carbon footprint and the things that are happening. So as a result of many, many decisions that we made on the project, we were seeing essentially a 64% reduction from what you would typically see in a building like this. So I won't name all the strategies here, but you can see, rooftop photovoltaics, a lot of things happening in the building facade, and then incorporating a place that's in between the garage and this building where the biofueling is happening. And so we'll talk a little bit more about that. So that leads us to kind of our last area on the placemaking and experience, focused on design for a holistic impact.
So I wanted to use this opportunity. There's so many aspects of placemaking that we could speak to, but I chose just to focus this section on biophilic design. I think as humans, we thrive because of our connection to nature. That's just how we are wired. But unfortunately, the lifestyle that we live, we spend 85 to 90% of our time inside the built environment, living in buildings. So what is our responsibility as designers, as I think about the future, is to create a greater connection. Now, this connection is not inexpensive. There's pragmatic challenges that you could talk about, all of that, and I'm not discounting any of that. But having said that, it's about finding every opportunity that you can to allow you that connection. Now, this is a very forward-thinking project in Belgium, where biophilic design was not just like in places, in moments, but was the entire building. It has been increased. So every space in the building has access, every patient room, every window has access to that. And I think this is kind of the paradigm of really kind of pushing the envelope if you wanted to think about that. But it's really comes down to creating opportunities for places where you can just go have some fresh air. Sometimes it's just so cold in the building. I just need to step out and, just kind of be able to take that moment. But also as you walk in, and you're, let's say in the public spaces, how can you continue to kind of engage with that? This is an internalized courtyard. How can you introduce nature which is outside, but still has a connection? And coming back all the way into the patient room, how can we reimagine the patient room where biophilia there is a connection to that? Now, not every piece of that has to be in its physical manifestation. We've used biophilia in art, we've used biophilia in other ways, but creating that strong connection is something that's most important for us. So at the end, I guess for this particular section, I would say concluding is that we believe design can have a really positive impact from the perspective of the planet, the people, but most importantly, the purpose that we want to kind of serve as we sort of think about that. So let's close out our presentation. And again, if you take nothing from us today, just remember these 3 things. What is the design process about? It's number 1, about a vision and a roadmap. Number 2, it's about placemaking. And number 3, it's about creating positive experiences that can continue to enhance what you do. So with that, thank you so much. We will be happy to open up for questions.
If you have questions, there's everyone have their online submissions and you guys in the room, feel free.
So I have sort of 2 sets of questions.
Sure.
First of all, enjoyed the presentation. But in thinking about UAV, and certainly Arpan can speak to this, we have a very old physical plant. And most of what I saw on in your presentation appeared to be new construction, with the exception of the mental hospital. And I'm wondering if there's any hope for old physical plants to be re-envisioned, reimagined. Can we have roadmap placemaking and experience in an old place? And then also, to me, that either with new experiences or with reimagining of old experiences, are we planning for the long-term maintenance of that beautiful space? So I should also say I'm a clinician in the basement emergency department of that beautiful children's hospital. And we feel the 1 year of design time that was cut out of that project. So I am
Asking on to your question.
yeah, answer any part of that.
Okay, I'll be happy to take the first part. It was actually, we met with Arfan this morning and he asked a very similar question. It was not by intention that we just sort of kind of showed, but I would just tell you that today, 80% of the build stock exists, right? There is already a lot of building stock that is, I think, our responsibility. In fact, 75% approximately of our work is in modernization and addition. It's not in greenfield construction. And what that means is, so is there a roadmap for a place like this? Absolutely. It would have to be an incremental change, I think, which is what we would have to do because of two things. One, just the sheer scale. We cannot overnight flip this into something completely different, but also just the physical attributes of disruption that happens. This is a living 24/7 building. This lives and breathes 24/7. There's no moment to kind of close it down. And so one of the things that we're really thinking a lot about as we sort of think about placemaking, think about road mapping, or think about creating an experience is that, in fact, one of the things we talk a lot about when we go through design is what is the experience during design? Because it's not just about getting to the destination, but it's like, what was my experience getting to there? It sucked. I hated it. It was like so bad. I'm not even looking forward to it. But paying a lot of attention to that process, that journey, I think is equally important. So I think from my perspective, yes, we see it many, many ways, many different places. We showed one example of the Texas Medical Center, which is like the largest medical center in the world. There is nothing but what we just talked about.
I think UAB, we have several examples. I mean, I look at the Women in Infants facility, we talk about the journey of design and, several years later, the facility is still like the day we opened it, because it's a team. You look at the project with genomics, a lot of the concepts that you talked about, how we get, collision of ideas, the clinicians and opening that campus. So we are taking projects in a granular and yet in a structured way, taking a lot of the ideas that Charlotte demonstrated. I think for us, it's bringing them all into cohesion. That's an important element.
Yeah, and kind of getting maybe to the background of your question, perhaps. It really depends on what function is trying to be placed in the building. What we run into so often is, unfortunately, healthcare is facility obsolescence. So low floor-to-floor heights, whatever's being new, it doesn't even match, and now you're into ramps. Or, rooms are too small to try to go through the whole building and redo it. And if the patient care is going to stay in there, it becomes very disruptive. So it's not impossible by any stretch. We do a lot of renovation, but it can be, you have to really be careful about how. We've got one project we showed our Hans group this morning, 32 phases. And it went from old to looking brand new, but we've got to really be mindful about the experience during construction.
Yeah, well,
Operators.
one last thing I think you talked about, I'm trying to make sure I'm unpacking all your questions, but one thing was about maintenance. I think you said I think it comes down to priority. It's about what's the value proposition. Every time you create a space, there's a sense, sometimes it's a quantifiable value, or sometimes it's qualifiable value. And I think that's where I think it comes down to about kind of creating that priority and what you would like. The example we showed at Stanford, where it's a Plaintree institution, they believe in taking care of the caregiver equally as that, and we talked about dollars are always short. And we had those moments on the project and they said, let's take all these spaces that are on the outside, take it in, like, let's just create them into like exam room. But they said, no, that was our vision. We said that we were gonna do it, we're not gonna compromise on that. And I'm really proud of them that they held to that ground. So I think it again comes down to something would have to give because there's not enough money to kind of do everything. So it'll just probably come to that conversation.
So
So
we have a question
Yeah.
from Nosley. It says, what about the effects of environmental design specifically on patients and night shift workers? So a big deal in our work is really paying attention to circadian rhythms, right? The ability to see outside and where we have spaces on the inside, with this light sensitivity, we need to really pay attention to that. I had a really good friend of mine who went through 9 months of pancreatitis. And I didn't know what it would be like with that, but visiting him, he was so sensitive to light. And so the ability for us as designers is providing space where 100% of the natural light can be blocked out. So I don't know if that's getting exactly to the question that was asked, but we have to be very sensitive about that for different reasons, the worker as well as the patient.
any other questions?
Yeah, I have one about
Sure.
the longevity of design. So I'll go through this as an example. At one point, we loved this and we built everywhere and now we need it. So what are, just realistically, there are some that are great examples, but what are you doing to make sure that's science?
Yeah, that's a great question.
So, yeah.
Go ahead, Tushar.
No, I think one of the things that foundationally is everything timeless now. I think there are some things that are timeless. But I think what we, at least our approach to design always is about creating a connection to the place. So, does the architecture respond to the regionality? Does it respond to the climatic? So again, trying to break it down to those attributes. Now, how compositionally things come stylistically is something that can, over time, maybe take. What we try to at least aspire from our perspective is we are not into trend. Trend dies soon. We're into really thinking a lot beyond that, thinking about design as a much deeper way to get there. So therefore, there is a purpose. Like if you just because stylistically it's going to be really cool to put all these shading things on the building. Well, it's got to serve a purpose. If it helps us to reduce our heat load on the building and add aesthetics, sure, let's do it. But I think that's where I think it's a little bit of a fine line from my perspective on that. And one thing we had actually talked about when we were first kind of thinking about this presentation was we believe every project, every place has a story. You just have to find it. So when we think about when we start a project, we spend a lot of time in our studios and talking to our clients, trying to find that story. And it doesn't come easy. You have to really work at it. But it's about trying to find what is the story of that place, of that building, of the project, and then manifesting them and turning that into something design that becomes aspirationally bigger than just solving for the problem, which is, oh yeah, we need 5 clinical units, we need, a cancer program, we need this, but really trying to take it much higher than that. What is the purpose of this place in the biggest context of the community? And I think that's what we believe is placemaking. It's about finding that real story and build that this project become that.